AlisonWinePromo.com, as you have been watching this show for a while, you know they've been with me for a while through a lot of dicey interviews and a lot of dicey topics, and they never shy away because they're just an extremist wine company and they're not afraid of extremism because all the wines are for the extremist that does not want to go to federal prison. Here's why they're extremists. A lot of them come from between 6,000 and 9,000 feet. So some of the highest vineyards in the entire world. They come from small family operations, and we're opening it beyond Argentina now. We're going to open the wine club to vineyards in France, Spain, Italy. And instead of just ordering a bottle or two here and there, you join the club, and every 3 months, you get 6 bottles of wine. And that way, whenever you're going to the party that's really awkward, you're trying to apologize for unfriending somebody over Trump or the vaccines or whatever else it was that you unfriended them for, you can bring a great bottle of wine, which also comes with a great message that it's extremist wine, uncensored wine, wine that supports Alison, and it's a conversation starter on top of just always being a great taste. And you will never be empty-handed, again, going to one of those awkward cocktail parties. Dr. James Miller, he was on, I don't know, probably a year or so ago, going back to this King 5 story about how awesome the Seattle Children's Gender Clinic is. It's really just fascinating because, like, here's the quote. Gender-affirming care is life-saving care, Colin said to UW News. This care does have a great deal of power in walking back baseline adverse mental health outcomes that the transgender population overwhelmingly experiences at a very young age. Now, that doesn't necessarily, they're not saying that gender affirming care is always surgery. So, you know, they're saying that what they're doing. But I guess what I find interesting about all of this is just the amount of positive verbiage that there's very little, there's nothing critical. What do you think about that?
Well, like I said, you get arrested for saying something critical in Washington. As a surgeon, if you say like anything, you get re-education classes in the busy hospitals. So of course people are quiet. Most people just don't want to even address it. So I think that the lack of critical thought on this is one of the important issues, because I think we're entering this age where it's very hard to trust medical literature because, you know, it wasn't long ago where the people who published this were trusted folks. And now we all are seeing by just some data points that you can't deny that was never true, that 100% of what they wrote there was just wrong. And so my concern as a clinician is that I don't know. It's increasingly hard to know what to trust, who to trust, and because I think that the data they show is just pure fabrication.
Well, I'm guessing too at Seattle Children's they got a lot of money for this stuff, and it can't not work for the funding purposes. But yeah. I have a feeling a lot of these doctors are very religious about it. And maybe you could confirm or deny that for me, that at the end of the day, it seems to me, even if profit is one of the benefits, that the vast majority, just like in journalism, the vast majority are really true believers in it. It's not like they really believe one thing, but they're just convinced to do it because of the money. Seems like there's, in all of these professions, really there is a buy-in that has nothing to do with money. It's a value for them, and they really believe they're doing a public service. And so I'm curious how do they talk about the studies like this one? Do they just say it wasn't done right, or they don't know about it, or they don't care? I mean, how do they hold those two in tension? I mean, I looking back on my career in journalism, I was unaware of a lot of the perspectives that I think would have made me a better journalist, in large part because I really just did not have the time. I didn't have the time to do good journalism because I was running around like a chicken with my head cut off, trying to get everything done by deadline. And also because in Seattle, it was very easy to stay ignorant of certain things because it was just so myopic and homogenous in the ideas you were hearing, not necessarily because there weren't people out there with differing opinions, because they didn't say anything because they were scared of, retribution socially, I think. So if you didn't have the time and you just assumed that you knew what you were talking about, but you were pretty ignorant, but you didn't know you were ignorant like I was, it was easy to just continue maintaining your ignorance. Eventually you change, but like there was also a lot of people who were just true believer martyr type journalists who just they would have looked at this and said this was just an outlier study that this doesn't prove anything. And so how did doctors explain that away?
Yeah, and I think that one of the problems that we've seen in the last 4 years in America is realizing that doctors are not immune to this. Doctors are not immune to social pressure. Doctors, particularly doctors who take care of kids, are inherently people pleasers, and the level of scholarship. It's been heartbreaking for me to see, to be honest, because I used to just really hold up my profession. I used to, I was some of the proud moments of my life was when I got, inducted into certain levels of the medical hierarchy. And then to see like, well, we just like in a breath abandon all our principles because that's what was popular. And so I don't think the analysis of the ideologues is sophisticated. I think they're looking for a predetermined outcome 100% of the time, and trying to have an actual academic conversation with some of the transgender ideologues. It's just there's no point. I mean, it's like some of the interviews I've seen lately, where you watch, some of the news people who have like, oh, actually, I was hurt by the vaccine. They refuse to apologize. You just can't talk to them, and that's how I found with the ideologues. It's not like we're all liberal-minded people who are academic and have a certain set of, shared values that we, agree upon with data. It's instead, does my experience or my interpretation of the literature prove my point? And it just puts us in a really hard place. That being said, I don't have, no, I do actually have friends who are absolute ideologues on this, who are super pro-transgender, but they're so shrill that if you just say to them, hey, it's a nice day, I saw boys and girls playing, they're like, transphobe, because you just said girls and boys. You're like, oh my gosh, you're like a board certified surgeon. Like, you should take a breath and just enjoy that it's a pretty day. Like, there's nothing ideological in that statement. And so I found that there is an extremism that's just, it doesn't allow for conversation. This is what I was saying before. I think we're entering this really creepy dark age. We don't know what to trust. And then people are so emphatic about stuff without allowing for an open and honest discussion of the data. I find it very unproductive.
Yeah. Yeah. It's not just this topic. It's lots of topics are just like that right now. And
yeah, I'd sent you an article about appendicitis, which is like, no one's really that emotionally attached to their appendix.
Right.
And I was part of this hospital who was part of this multi-institutional study that published, I'm not sure what the published date was, but it was during the time of the same time. So we published in 20, but we've been doing it for a few years before. And this was all the rage. Now, historically, this has been discussed in medical literature since the 1970s, maybe even earlier, about treating appendicitis without surgery. Fair enough. Interesting discussion. You can talk about it which way in that. The authors of this study, the lead authors, one of whom I know personally, they got together at first like 10 centers, and then it broadened out to look at, people who come in with early stage appendicitis, whether treated with surgery or not surgery. Fair enough. It's an interesting intellectual question. The hospital I was at had a very ethical lead investigator, and we signed up like, yeah, this is good. This is a good clinical question to answer. And they told us what the predetermined outcome was, what they assumed the outcome was be. Our hospital enrolled the most patients, wasn't even close. Our outcome was not what they expected. It was much worse. So they sent investigators to have us correct how we were collecting our data. It was preposterous.
Wow.
The lead investigator from our hospital just like, this is a modestly PG program, but quit well from a surgeon's, not politely. It was my understanding. I wasn't there for it. But right behind her was another one of my friends who stood up and said, I'd be happy to push this. So if you look at through the text, they say, oh, it's non-inferior. Well, what's interesting about this study, and this is part of the tragedy of it, is there's conflicting data coming from Europe and specific European countries which show a really good outcome of antibiotics versus non-antibiotics. Okay, we did not conclude that in America. So they buried that. They said the opposite, even though the data really couldn't be denied when it all came out. And the tragedy about that is I think there's a gem of wisdom in there that we haven't addressed, and that's the nutrition for Americans. Eating a pro-inflammatory diet is very different than the diets of, say, the Danish, who have really good outcomes. And so we falsified. We nudged our data to the data couldn't support the predetermined outcome, even though they replaced our chief investigator. It still just didn't work. And then we lost the opportunity to have the honest intellectual discussion of why is it that the immune systems of other countries where possibly they don't have the same processed foods in their diets, possibly they have a lower inflammatory diet and lifestyle, they're therefore able to not need surgery for the same level of disease. Like, that's a really interesting discussion. That discussion never brought up. That has broad sweeping implications. But because we didn't handle our data honestly, and because we didn't come to the predetermined outcome, they tried to make it sound like we came to the predetermined outcome, and then hoped that people only read the abstract but didn't read the actual data. And I think that we're seeing this just across the board in medicine.
Text Alison to 989-898 and you get a free info kit on gold with no obligation. For the first time in our history, the interest we pay on national debt has surpassed every individual budget item except Social Security. So basically that means the US now spends more on interest than on national defense or even Medicare. And it's just getting worse because we continue to spend. So if you're somebody who is like, I'm not going to bank entirely on my 401k or my IRA, and you want to invest in gold, again, great chance. Do it. Birch Gold's been in business over 20 years. They've had thousands and thousands of customers and get lots of 5-star reviews. And it's an easy way to get more information while also supporting the channel. So text Alison, ALISON, to 989-898 today. And I'm going to ask Dr. Miller, too, about my garden and why I can't seem to grow any food, because that's probably another great thing to invest in.